Hello, and welcome to this Anatomy Physiology Bio 201 video lecture on the axial skeleton. I'm Mr. Kennedy, and I'll be your guide as we explore this topic together. We begin by looking at the divisions of the skeletal system. The human skeleton consists of 206 named bones grouped into two principal divisions. The axial skeleton, which is composed of 80 named bones, and the appendicular skeleton, which is composed of the remaining 126. The axial skeleton includes the skull bones, auditory ossicles or ear bones, the hyoid bone, ribs, sternum or breastbone, and bones of the vertebral column. The appendicular skeleton includes the bones of the upper and lower limbs, or your extremities, and the bones forming the girdles that connect the limbs to the axial skeleton. Types of bones. Almost all bones are classified into 5 main types based on their shape. We have long bones, which are bones that are greater in length than width. We have short bones, which are cube-shaped, flat bones, which are thin and made up of parallel plates, irregular bones, which have complex shapes, and sesamoid bones, which are shaped like a sesame seed. Sutural bones. Sutural bones are small, extra bone plates located within the sutures of cranial bones. Sutures are the joined areas where flat bones come together, as illustrated in the skull seen below. Bone surface markings. Bones have characteristic surface markings. These are structural features adapted for specific functions. There are 2 major types of surface markings: depressions and openings, and processes. Depressions and openings allow the passage of soft tissue and form joints, while processes are projections or outgrowths that also participate in the formation of a joint and serve as attachment points for ligaments and tendons. Fissure. A fissure is a narrow slit between bones for the passage of blood vessels or nerves. Seen in this diagram is the superior orbital fissure at the back of the eye socket. A foramen. A foramen is a hole for the passage of blood vessels, nerves, or ligaments. Illustrated here is the foramen magnum at the base of the skull in the occipital bone. A fossa. Fossa is a shallow depression. Fossa can be seen in this view of the skull with the mandibular fossa illustrated. Sulcus. Sulcus is a furrow on a bone for passage of blood vessels, nerves, or a tendon. And a medius is a tube-like opening. Here we can see the external auditory medius on the skull below. Condyle. Condyle is a rounded projection with a smooth articular surface. Here we see the condylar process of the mandible. Facet. A facet is a smooth, flat, slightly concave articular surface. Here we see the facet of the superior articular process on a vertebra. Head. The head of a bone is usually a rounded articular process supported on a neck. Here we see a typical rib bone with the head and neck labeled. Crest. A crest is a prominent ridge or elongated process. Here we see the median sacral crest. Epicondyle. An epicondyle is usually roughened projection on a condyle. A line. A line is a long, narrow ridge or border, less prominent than a crest. Here we can see the superior nuchal line and inferior nuchal line. Spinous process. Spinous process is a sharp, slender projection. On this slide, we can see the spinous process projecting from a vertebra. Trochanter. Trochanter is a large projection found only on the femur. Tubercle. Tubercle is a variably sized rounded projection. In this diagram, the articular tubercle is illustrated. Tuberosity. Tuberosity is a variably sized projection with a rough, bumpy surface. Here we have the sacral tuberosity illustrated. The skull. The skull contains 22 bones, not including the 3 middle ear bones in both ears. Associated with these bones are a number of processes, ridges, lines, depressions, and foramen. Use this and the following diagrams to familiarize yourself with the bones of the skull. Take time to practice the proper position and names of bones from a variety of different views. This is the anterior view of the skull. This is the right lateral view. You'll notice many of the same bones are labeled. This is simply meant to give you a different view or perspective. Again, practice naming the bones. This is the mid-sagittal view. Here we can start to see some of the internal structures of the skull, along with those that were labeled externally. This is the posterior view of the skull. Again, take some time to familiarize yourself with each labeled structure. This is the inferior view of the skull. Many of the things that you see labeled are identical to previous pictures. Again, this is meant to offer you a different perspective for study. And here we have the superior view of the sphenoid bone in the floor of the cranium to illustrate the internal structures of the skull, specifically in the cranial cavity. Again, take some time to familiarize yourself with each of the labeled structures. The mandible. The mandible is the lower jaw, and it is the largest, strongest facial bone. Other than the middle ear bones or auditory ossicles, it is the only movable skull bone. The mandible is illustrated here with all of its labeled parts. Paranasal sinuses. The paranasal sinuses are mucous membrane-lined cavities in the frontal, maxillary, sphenoid, and ethmoid bones. They are used as resonating chambers to enhance the voice, as well as structures that increase the surface area of the nasal mucosa to help to moisten it as well. This is an illustration of your paranasal sinuses. Fontanelles. Fontanelles are mesenchyme-filled spaces between cranial bones present at birth. They close up beginning at 6 months of age through 2 years. The hyoid bone. The hyoid bone supports the tongue by attaching to muscles. It is situated at the top of the larynx. This is the vertebral column. The vertebral column is also known as the spinal column, backbone, and spine. It is made up of 26 vertebrae divided into 5 regions. The lower regions, the sacrum, made up of 5 fused vertebrae, and the coccyx, made up of 4 fused vertebrae, are not individual bones, as are the other 24 vertebrae. The column protects the spinal cord. Intervertebral discs. Intervertebral discs separate the vertebra from one another. They are located between the bodies of the vertebra from the second cervical to the sacrum. Each disc has an outer ring of fibrocartilage called the annulus fibrosus, which surrounds soft, pulpy nucleus called the nucleus pulposus. The top and bottom of each disc has a layer of hyaline cartilage. They are used to absorb shock and create spaces between the vertebrae. This diagram illustrates some of the basic structures of a vertebra and their relationship to the intervertebral discs. A typical vertebra is composed of several parts. Vertebra from each region, in addition to containing common structures, have unique structures that help to identify which type they are. In addition, the first two cervical vertebrae are different from the others in shape and function. This is an illustration of your first two vertebrae. Notice the distinct differences as we compare them to vertebrae in other sections. Take a moment to familiarize yourself with each labeled structure in these diagrams. The thoracic vertebrae support the ribs and have special structures for rib head and tubercle attachment. The thoracic vertebrae are those associated with the ribs seen here in this diagram. This is a typical thoracic vertebra. Take a moment to familiarize yourself with each labeled part. The lumbar vertebrae are the largest and strongest in the vertebral column. They support the body's weight. There are no special structures that are specifically associated with these vertebrae. The only thing making them unique is their size. Take a moment to familiarize yourself with each labeled structure in the vertebra at the bottom of this slide. The triangular-shaped sacrum is composed of 5 vertebrae that begin to fuse together between 16 and 18 years of age. The process ends at around 30 years of age. It is part of the pelvic girdle. The coccyx is also triangular in shape and is composed of 4 vertebrae that fuse together between 20 and 30 years of age. This diagram illustrates the sacrum and the coccyx. Take a moment to familiarize yourself with the labeled structures seen here. The sternum, or breastbone, is a flat bone and is located in the center of the anterior thoracic wall. It is divided into 3 segments: the upper penembrium, the middle body, and the lower xiphoid process. The 3 bones usually fuse by the age of 25. The sternum articulates with the clavicles and the costal cartilage to form the rib cage. This is an illustration of your sternum and a second illustration showing its relationship to the costal cartilages as it forms the rib cage. The ribs. The ribs provide support to the thoracic cavity. There are 12 pairs that extend from the thoracic vertebra to the sternum. The bony portion ends a few inches from the sternum and is connected to costal or hyaline cartilage, which attaches to the sternum. The first 7 pairs are called true ribs because their cartilage is directly connected to the sternum. The next 5 pairs are called false ribs because their cartilage is indirectly connected to the sternum. Pairs 8 through 10 are not connected at all. This is an illustration of a typical rib bone. Take a moment to familiarize yourself with each labeled structure. Disorders. Many disorders may occur that affect the skeleton in one form or another. In the vertebral column, a common disorder is a herniated disc, and it may occur due to trauma or sometimes simply associated with aging. In these cases, the nucleus pulposus is able to leak out due to a tear in the annulus fibrosus. At times, the normal curves of the spinal column may become exaggerated. There are many causes for these changes. These curve-related pathologies include scoliosis, kyphosis, and lordosis. Each of those curvature disorders is illustrated here. And finally, we have spina bifida. Spina bifida is a congenital defect of the vertebral column where the lamina do not normally develop. The degrees of this deformity vary from minor to severe. In the latter case, a cyst-like sac containing the meninges and cerebral spinal fluid and the spinal cord and/or its nerve roots can protrude from the spinal column. This is an illustration of a severe case of spina bifida, and this ends our coverage of the axial skeleton.